Hello, everyone. You're listening to Health Professional Radio, and I'm your host for today, Tabitha Moritto. Our guest today is Shubha Manoharan, dermatologist and director of Burst-Vein Skin. Today, we're going to talk about a condition known as severe primary axillary hyperhidrosis. Without further ado, welcome to the show, Doctor. It's so nice to have you here.
Thanks, Tabitha.
Can you please tell the audience more about yourself and something about your background?
Sure. I'm a general and procedural dermatologist based in Brisbane, Australia. I'm the medical director of the Brisbane Skin Group. We have 4 clinics situated here in the city and in the suburbs in Brisbane, as well as Westside Dermatology, another suburban dermatology practice. We're a full-service dermatology centre where we service all types of dermatology conditions, all the way from inflammatory conditions to skin cancer, as well as aesthetic work. I have a personal special interest in the treatment of hyperhidrosis, as well as acne scarring and laser rejuvenation. I'm the Director of Training for Queensland for the Australasian College of Dermatologists. And myself and my wife, Patricia, we also have a consultancy firm known as the Manoharan Group, which provides consultancy services to specialist practices in terms of startups, implementing systems, staffing, business development, and making specialist medical practices saleable entities.
That sounds wonderful. So now, doctor, tell us about this condition that involves excessive sweating in the underarms.
Excessive sweating is, or what we describe as hyperhidrosis, is relatively common. Up to 2 to 4% of the population will have some form of this. Now, it could either be what we describe as idiopathic, so that's basically an individual who sweats due to no particular external cause, and this is due to an overactivity of the temperature control system in the brain, which sort of sends the body into an excessive sweating pattern. Or it could be a secondary hyperhidrosis, which is sometimes more worrying. People can get excessive sweating as a result of medications or infections and cancers, malignancies. Mainly, the biggest group of patients that we treat are the ones with idiopathic hyperhidrosis. And within this group, axillary hyperhidrosis, or sweating underneath the armpits, is one of the big 3. So the other 2 big regions are palms and soles. And face and scalp are your other 2 big areas. We've been involved with a group in setting up a group of clinics known as the Sweat-Free Clinics a number of years ago, and Brisbane Skin's part of this group. And we treat a lot of idiopathic axillary hyperhidrosis, as well as all other forms of sweating. And we do this with a combination of treatments, including topicals, oral medications, as well as procedural and device-based solutions as well.
That's very interesting. So, doctor, can you tell us, are there any misconceptions about this condition that drives you nuts and it keeps you up at night?
It doesn't particularly keep me up at night, but I think one of the biggest misconceptions is that the condition is something that we really need to live with or cannot be treated adequately. Certainly for many, this is the group of hyperhidroses are chronic conditions, but for the majority of patients with it, there are very good treatment solutions that can keep their sweating under control and maintain their level of comfort and both emotional and psychological discomfort with it to a minimal extent. And so what I really do urge is that both patients and practitioners look to either treat this early or if they're unable to do so in their own experience or with their own clinical experience, they can refer on to us at an early stage.
That's good to know. Now, doctor, if you don't mind, can I ask you a personal question?
Sure, depends then.
Don't worry. Can you tell us, why are you so passionate about dermatology?
Very passionate about dermatology because it's an aspect of medicine which really interests me from the point of view that there's a medical component, there's a surgical component, and there's a significant aesthetic and cosmetic component. So the fact that this specialty encompasses all of these in the one umbrella gives me a good variation in my day. I can be seeing a patient with a rash 1 minute and cutting out a skin cancer the next, and using an injectable to enhance someone's features the very next moment. So it's a very varied list, and for someone like myself who's got who likes a varied working life, this really does suit me and interests me greatly.
That's wonderful to know. Doctor, I would love to chat with you more, but we're running out of time. But before we go, what is your main takeaway message to all of our listeners out there, especially people with this condition?
The main takeaway message is that there's good effective treatments for hyperhidrosis, particularly axillary hyperhidrosis. Injectable treatments are fabulous for this reason. There's muscle relaxant injections we can give patients, which are partially covered by Medicare, for patients who've failed other treatment options, and this can really make a big difference and provide, on average, at least 5 months sweat reduction to patients. So definitely look into getting treated early and seek a practitioner who's experienced in this, and hopefully we can make a significant impact for you today.
That's wonderful to know. And lastly, doctor, for those who want to get in touch with you or maybe make an appointment with you, how can they do that?
You can contact us through our website. That's www.brisbaneskin.com.au. And the team here will then connect you to me or enable you to have an appointment with us.
That's wonderful. Thank you so much, doctor, for coming on the show. It was fantastic having you.
Pleasure. Thank you. Thank you for having me.
And that was Dr. Shubham Manoharan. If you like this interview, transcripts and archives are available at www.hpr.fm. We're on all social media platforms, so don't forget to follow, like, and subscribe. Show us some love by subscribing to our HPR YouTube channel. We're also available for download on SoundCloud and iTunes. This is Tabitha Moretto, and you're listening to Health Professional Radio.